your kidney is not doing its job. So you need a
Exactly.
machine to clean out your blood.
Yeah.
We take a lot of over-the-counter
We
medications
do.
that we're not aware it's actually
Damaging,
causing
yeah.
damage versus helping us. Hi everyone, my name is Anastasia and welcome to my channel. Today we have a very special guest. I went searching all through the Queensland and I found the most experienced and the most knowledgeable nurse, and she has agreed to talk to us. So come with me as we talk to our special guest today. How are you and how is the family?
I'm well. Thank you for inviting me.
Good.
And I hope you are well too.
Yes, we are all doing well. So everybody, this is Mami Ifwa Dakwa. She is our special guest today. She's a dialysis nurse and she had agreed to talk to us. Mami, tell us a little bit about yourself, your background, what made you decide to go into nursing and specialize in dialysis?
Okay. Hi, everyone. My name is Mami Efua Kodakwa. I was born in Ghana and I lived there until I was 17. So when I got to London, I had already done my junior high and senior high. So I went to college and I chose to go into public health. My mom said, you can't do any journalism or anything like that because my money is not going to pay for that. You have to choose something that is going to
Guarantee money, which is very common in, a lot of immigrant communities.
Yeah.
Mothers and parents want their kids to go into businesses or careers that will guarantee money. There's no time for a music major or something in the arts. It's always either medicine or a lawyer or a doctor or a dentist, something like that. So that's very relatable.
Yeah. So I chose public health. So I started my public health, and whilst I was studying, I decided to work. So she found me a job in the hospital. And so on the day of the interview, whoever picked me apparently picked me for dialysis unit. God bless her, Saida Abbas. So she hired me and I went into dialysis unit. Before I was scared of blood. So the first day I almost fainted.
Oh, wow.
But then with time I got used to it. And then I started learning my job and everything went well. But my decision to go into nursing was not entirely my decision. I wanted to stay away from blood. But my manager influenced that decision. And then the nurses in the unit, the doctors, the dietitians, they were all pleasant people. They all influenced my decision to go into nursing. So a time came in the unit, they wanted to sponsor technicians to do their nursing. I had just finished my public health. I didn't want to go into nursing, but she told me that even though you're going to go into public health, which is preventative measure of health, you need the curative measure of health, which is nursing. So you should be able to cure and prevent. So I thought that was very smart and intelligent. So I went for the interview. There was a lot of technicians from different departments, but they chose 2 people, and I happened to be one of them.
Amazing.
Yeah.
So you're smart too.
I'm not. It's the grace of God. Yeah. So I was chosen and I went into nursing right after my public health for 3 years. In London, we study for 3 years.
Whereas in America, it's 4 years.
Yeah.
So would you say it will be advisable for somebody to maybe go to London, get their nursing degree, and then come here? Or you think it's better to do the 4 years in America?
I think it works both ways based on where you are. But Americans do more, and it's actually very detailed in America. You do everything as a nurse. Meanwhile, in London, we just do 3 years, and the first year you know everything. The second year you choose a specialty. So it's either you go into mental health or you go into child health or you go into
Mm.
adult nursing.
Mm.
So yeah, there's a big difference. And I
Yeah.
actually paid for it because when I came here, I
Yeah.
had to learn everything to pass the NCLEX.
Yeah,
Yeah.
that's another thing. American nurses have to pass the NCLEX to be able to practice as
Yes,
nurses.
exactly.
So when you come here from another
London.
country,
Mm-hmm.
you still have to go through the same process and take the test to pass.
Exactly.
Okay.
So in that case, you have a lot of deficit in knowledge compared to an American trained nurse.
Okay. All right.
Yeah,
So you were
so
sponsored, they picked you, and
yeah,
then you went for 3 years.
and then I went for 3 years. So after the 3 years, I had a choice to either stay in dialysis as a nurse or go to a different department. But I chose to stay in dialysis because I already had the foundation. I knew how to set up the machine. I knew the nurses. I knew the doctors and all that. So it was easy. That was the reason that I stayed.
You chose,
And my manager also wanted me to stay.
Oh, so you were working as a dialysis tech whilst in nursing school?
Yes.
So when you graduated after the 3 years, did you have to take any specialty class?
No.
Or it was just after 3 years of nursing school, then you just go into dialysis as a nurse?
Yeah. So 3 years of nursing school, everybody can apply and get a job in dialysis. Once you get into dialysis, then you take the specialist course, which is the certification to become a dialysis specialized nurse. So they can hire any RN in dialysis.
Okay.
They train you. Then you decide if you want to specialize in that. Then you take the certification too. So yeah.
Okay. So do they have their certification here in America too, or is just in London?
No, in London they do, and here they do.
Oh, so
Exactly.
both
Yeah,
countries,
both
you
countries, but
if you want to specialize, you take the
exactly.
test.
But then you cannot bring the certification from London here. You have to take again here. But you can bring the skills and get a job in dialysis.
So not every nurse working as a dialysis nurse has a certification.
Yes.
It's a choice that
It's
you
a
have to
choice that
make.
you have to make.
Okay, got it. All right. So now break it down for us. What does it mean for somebody to go to dialysis? What does that mean?
For someone to go to dialysis, the person might have had a failed kidney. So that means the person's kidneys are not functioning like you and I. So in that case, the doctors have detected it, so they put the patient on dialysis. Dialysis means that machine, artificial kidney, and then what we call electrolytes like calcium, potassium outside it, because you need all that for the kidneys to function. So you have all these things, they come together, then they use it to clean your blood. They use it to take out fluid from your body, and they use it to also balance the electrolytes that are not balancing in your system.
The balancing is not balancing.
Exactly. But the kidney's function is to take out toxins from your body, waste products, and then also to take out fluid and also balance your electrolytes. So that's what we do. It does not.
So dialysis is basically kind of like cleaning your blood.
Perfect.
So the function of your kidney is to clean your blood.
Yes.
And so when you have kidney disease or kidney failure, your kidney is not doing its job. So you need a machine to clean out your blood, basically. Okay. All right. So what are some things that we should be looking out for? If I see in my body, it would trigger me to say, hey, doesn't seem right. Let me go to the doctors and go check it out.
You need to be aware of your blood pressure. So if you see a very high, a very low, you need to make your doctor aware. You need to be cautious also. There's something that we miss, like smell in our mouth, bad smell. Exactly. So that means that something within is not working. So you're constantly getting a bad smell. You need to get it checked out.
That's interesting.
Yeah.
Bad breath
Bad
is
breath.
a sign of something wrong.
Exactly.
Okay.
Some people are born with small kidneys. So from birth, you as a parent, you have to keep an eye on your child until they grow. So some of them, they start dialysis with that since they've been born with it. Eating habits. You need to watch your alcohol and smoking intake. And you just need to basically take care of yourself.
Yeah.
And also you need to make sure that when you go to the doctors, there's something that measures the kidney, EGFR. if you're interested, let them check it for you to see how your kidneys are functioning.
Okay. The EGFR is blood work.
Exactly.
To measure how your kidney functions.
Yes,
so that's
exactly.
something that we can ask our doctors when we go, hey, can you check my EGFR to see how my kidney functions? Okay. All right. And then what are preventative medicine? Things that we can do to prevent ourselves from getting bad kidneys.
You have to stay active. You have to eat healthy. You have to avoid that over-the-counter medication, all those herbal things that we take in to lose weight. They're chemicals or whatever it is that you're taking in. Some of them are very strong for your kidney. Your kidney is cleaning you. So basically, you have to make sure of the things that you consume. Those herbal medicines, those herbal supplements, you have to be aware of them because they can damage you. Stay active, limit the smoking and the alcohol intake. And look out if you're very anemic, you have to look out and treat it because anemia can also induce that as well. And drink more fluid, but not too much fluid. Look out for your urine as well. Sometimes too little urine can be a problem. Too much urine can also be a problem. So look out for that and then make sure everything is good.
Okay. The herbal supplements and the diet pills are a very good point to make because we take a lot of over-the-counter medications that we're not aware of. It's actually causing damage versus helping us. So that's a very good point. All right. So what kind of settings do you work in? Are you in a hospital, outpatient, nursing home? Where do you work?
I'm currently in the hospital, but I have had outpatient experience and never a nursing home experience, but outpatient. I've had home experience. That's where we do the PD, home dialysis, peritoneal. I've had that, and I've had the opportunity to work with transplant team as well back in London. So whilst you're doing your specialty, you go through all the departments in renal. So I've had all those experiences, but currently I'm in acute dialysis in the hospital. I love it. I think once you taste hospital, you don't
want to go
back to chronic because the workload is very different.
Okay, so tell us a typical day since you love it so much. What does a typical day look like for you?
A typical day can be a no patient at all.
Really?
Yes, because it's acute setting. So sometimes you go in a patient who you thought needed dialysis or a doctor thinks needs dialysis can decide that they want
DNR.
They want DNR or they don't want dialysis this day, and no one can force a patient to take dialysis. So you can have no patient if they choose not to do dialysis, and you can have max at least between 1 to 4 patients for the most part in our setting. So if you are doing the patient in their room, in the unit, is one patient at a time. But if you're doing the patient within the dialysis setting, we have a dialysis room, then 2 patients. So at the end of the day, you end up doing 4 patients, 2 patients at a time. But if you're doing them at their bedside, is one because you can only be at one place.
And how long does it take to dialyze one patient?
Oh, between 3 hours to 4.5 hours. It depends on the patient and the hours that they are prescribed.
Okay. So whoever the doctor that send them to dialysis will prescribe how many hours?
How many hours they can. But sometimes that changes. During the dialysis, there's a low blood pressure, there's other things happening, and they cannot take those hours. They are obliged to let us know that they can't take that hours and it can be cut short. But the prescribed hours are normally between 2.5, 3, and works
4.
up. The more hours you do, the more your blood is cleaned properly.
I see. So far, you're doing 12 hours, you said. How many days a week?
3 days a week.
Okay. Any weekend schedule? Or holidays?
No. Holidays, we get holidays off because the patients also need a break on holidays. So we make the schedule in the way that they get the time off, but they get the dialysis before the holiday. Do you
Mm,
get it? Or
hmm.
after the
So,
holiday?
like, let's say July 4th is a holiday, so
Yes.
they'll be dialyzed on July 3rd.
July 4th, no, maybe Christmas, New Year, those important special
Oh,
holidays.
okay.
July
So July
4th,
4th, you
they'll
still work.
still come. Unless they decide to be good people and stay in their house, we don't get them back. If they decide to abuse the water
Yeah.
and the food,
Then they'll be
then
there.
definitely they will be there. But
Yeah.
yeah.
Okay. So you think it's a good working as a dialysis nurse in a
Hmm.
hospital setting, in a acute setting, you have a good work-life balance. I mean, you're a wife, you're a mom, so working and managing home, how is that going?
It's going pretty well because I work 3 days,
Mm-hmm.
then you get every Sunday off. No
Mm-hmm.
dialysis nurse ever works on Sunday. That's one of the
Mm.
reasons why I chose dialysis. So then my weekends, I choose if I want to work on Saturday. So if I'm going to work on Saturday, that
Yeah,
means that one is gone, but Sunday automatically
you're
you're off.
off.
So you get to spend time with your family.
Yeah.
And also the good thing is that we don't do night shifts. So
Mm.
you go, you come back, you sleep in your bed.
And that's it.
Exactly.
So,
So
would you
yeah,
recommend working as a dialysis nurse to any
any
new upcoming nurse or even a seasoned nurse that is
yeah,
looking to, change specialty? Will
yeah,
you recommend?
I would
Okay.
anytime,
Yeah.
every day. It's a good specialty because you get to see a patient come in very, very sick. I love
Mm,
to see results.
mm.
So you come in very sick, and I love the fact that maybe you came in fluid overloaded. And by the end of the day, when you're leaving me, you're able to cast me out. Because when
Yeah.
you came in, you couldn't breathe.
Yeah.
But
And
now you're
now,
breathing properly to even
yeah.
tell me that maybe I'm a black girl, I shouldn't touch you again.
Are there a lot of black nurses specializing in dialysis?
Back in London, there was a lot,
Mm,
but here I see there's a lot of Koreans, Asians, and my
mm,
unit is packed with Asians,
mm.
and there's only few blacks. But that's because it's their choice. The way the dialysis is, if you're not careful, you feel like you're idle all the time. But no, it's not.
Oh,
It's not a specialty that you're idle. Most people, most dialysis nurses, they know how to plan their time
day.
and day,
Hmm.
so you have a lot of time to do your own little chatting, your
Yeah,
own little getting to know patient. You
yeah.
have a lot of room for that. When Whereas most nurses are so used to
Always being on the
always being
go.
on the go, so they
Yeah.
find it very. And I tend to hear that a lot from our
Mm.
people that, oh my god, I can't do this job, it's too boring. But it's not boring,
Ah.
it's just you have to
Fill your
fill
time.
your time.
Yeah.
Exactly. Yeah.
Okay. Well, thank you so much
You're
for coming
welcome.
and talking and educating us. Well, I hope you learned something from Mommy. Talk to you guys later. Thanks for watching.